So my name is Amy Jawahar, RMT. I've been a massage therapist since 2014, and I've been teaching in the program for about 3 years now. I've lived in Calgary and in Toronto and in London, and I've practiced massage therapy in all 3 of those cities, so it's been really great that it could move with me across Canada. When it comes to massage therapy, I'm most passionate about proactive care. So most of my clients come to me because they have some pain or some issue that they want to address. But after we meet those goals, I'm often able to help build a plan for them long term to keep those symptoms from coming back or to prevent future problems from arising. So that's really the side that I like, is proactively helping people have better lives or healthier lives. I was inspired to become a teacher through 2 things. I really enjoyed my program. So my teachers, when I was learning to become a massage therapist, really inspired me, especially my anatomy and physiology teachers. And I think clients and the public that I've worked with has inspired me as well. There's a very high demand out there for massage therapists, and it always breaks my heart when clients are not able to book with me or are not able to get an appointment with an RMT. So I was very eager to help get another set of students out there to meet this demand and to serve the public. This massage therapy program involves a lot of practical hands-on skills courses where the students come in and they work on each other to build new skills. And then there's also the theoretical and academic side where we really have to discuss, the anatomy, the structure of the body, how it works, and discuss diseases and conditions and how people can manifest and how us as RMTs can safely treat, anyone in the public, no matter what they're coming to us for. Students are going to learn about the anatomy of the body. We have to discuss the muscles, the skeleton, the bones of the body, and the joints in a lot of detail because that's where massage therapists really focus their skills. But we are also going to learn about everything, from the basic cell, how the cell works, discuss how tissue healing occurs, all in order to make sure that each massage therapist is able to deliver safe and effective care at the end of the day. And then on the other side, the skills side, we have to learn how to deliver our techniques to our clients in this safe and comfortable way. So how do we apply deep pressure? That's what a lot of clients are looking for. How do we improve conditions? Like how do we facilitate healing? How do we improve range of motion? How do we deal with pain long term, and so on? Just typical questions students will ask us as they're in the program is, what we like about massage, where we have focused in our careers, like what populations we've worked with, because you can really specialize in massage. You can work with, sports populations, athletes, or you can work with chronic pain conditions. You can work in hospital settings. So students are often really curious about the setting. And then students always want to know how much money we make, it always comes up. And the nice thing about massage is all the different variety and all the different flexibility. So in terms of practical training, like I said, we have to discuss how to apply pressure in a safe way to our clients and how to improve tissue health, whether we're dealing with muscle issues or joint issues or ligament and other soft tissue problems. We really want to make sure that we teach good biomechanics to the kids as well. Massage therapy can be really hard on the massage therapist. It can be a lot of wear and tear on our own bodies, so we want to make sure that our clients are using good biomechanics, good techniques, and they're not overusing their own joints. And so we'll teach them to use different contact, like their thumbs versus using their hands versus using their elbows, depending on the area of the body that we're addressing. So the College of Massage Therapists of Ontario, or the CMTO, that's our governing body. So like doctors and nurses and chiropractors, we are a regulated health profession, which means that the province oversees our practice or oversees RMTs as a whole. So the CMTO, that college, is actually that body that oversees all RMTs. So for any person to become an RMT, they need to first graduate from a program that the CMTO recognizes, and that is what it has, of course. After this program, you get your diploma, and then you can take that diploma to the CMTO, to that governing body, who will enroll you in examinations and certification examinations, and essentially they'll use that diploma and your results of your certification examinations to determine if you can safely and effectively treat the public. And if they determine you can, if you pass everything, then you get to be an RMT at the end. After the program, first you have to take that diploma to your certification exams and pass those. But once you're a recognized RMT, you can go to many different types of practice settings. There's like the personal service industry side of massage therapy, where you can work in hotels and spas. You can take that to cruise ships and travel as well with these skills. Or there's the more healthcare side, where you're working in clinics with other healthcare professionals, like with physios and chiropractors. Or you can work in hospital settings with doctors, with nurses, especially in rehab units in hospitals. And then you can also use massage therapy as your own business to keep yourself self-employed. And in those situations, you can work as a mobile practitioner, where you go out to clients that are looking for services, or you work from your own home or from an office space that you rent. So for future students, my biggest advice is, if you're curious about this career, to give us a call. There's lots of opportunities. Being an RMT is a very fulfilling career. At least I found it to be so. It's great to work with people. It's great that people leave your office feeling better than when they came in. And like I said, there's lots of different settings that you can apply this skill in, so it tends to be really flexible, and it gives you good work-life balance as well. So if you're curious about becoming an RMT or what it might take, please let us know.